Hi everyone, my name is Faith Okungu and I'm going to perform physical assessment head to toe for NU 650 health assessment class. And this is Catherine. Catherine, do you consent?
Yes.
And I'm going to wash my hands. I'm going to do a video of my surrounding area. And the floor. And these are the equipment I'm going to use. You can see. All right. I'm going to go ahead and begin. Then I'm going to wash my hands. I'm going to do general skin assessment, checking for warmth. I'm checking for lesions. I'm checking for any dryness, any significant warmth areas and no issues. I'm going to inspect your scalp. I'm going to palpate for any lesions, any other skin issues and no issues with that. I'm going to inspect your face, your head and your neck and no issues with that. I'm going to go ahead and inspect your eyes and no issues with that. I am going to check for pupillary reaction with my light. And I'm going to perform the visual acuity test. Catherine, if you can read the third line from the bottom.
AHJBS.
Okay. I'm going to perform the extraocular movement test. Catherine, if you can follow my finger. And I'm going to perform the visual confrontation for the fields check. If you can close one eye and tell me how many fingers you can see.
1, 2.
And the other eye.
1.
Look at me.
2. 1.
Okay. All right. Next, I am going to perform the do an ophthalmoscopic exam. Okay, and I'm going to check for red reflex. Okay. All righty. Next, I'm going to perform I'm going to move on to your ear exam, and I'm going to check for any deformities on both ears or anything unusual. I'm going to perform tests with my otoscopy just to inspect them. I'm going to pull up and outwards. Do that again. Okay. Good. Next, I am going to perform the whisper test. Catherine, if you can close your ear and tell me what you hear. 1, 2, 3.
1, 2, 3.
And close the other ear. 4, 5, 6.
4, 5, 6.
We're going to do the same. 7, 8, 9.
7, 8, 9.
A. Okay. Close the other ear. A, B, C.
A, B, C.
Okay. Next, we're going to perform the nose assessment. I'm going to inspect your nose. I'm going to palpate your nails, and I'm going to inspect your nails. Okay. I am going to palpate the frontal, maxillary, sinuses, no issues. Next, we're going to do the mouth and jaw assessment. Looking at your mouth, no issues. I'm going to ask you to open your mouth. I'm going to look at the back, your teeth, your gums, clench your teeth together. Okay. I'm going to ask you to put your tongue out and back in. I'm checking for movement, side to side. No issues. I'm going to check for the tonsils at the back. See any issues? Okay. And I'm going to check for the gag reflex. When your tongue is out. Good. All righty. I am going to palpate the temporal mandibular joint. If you can open your mouth and close. Okay, swallow hard. No issues. Next, I am going to move on to the neck assessment. I'm inspecting the neck and I'm going to evaluate the tracheal position. Issues. All right, I am going to go ahead and palpate for the thyroid. Is there any pain?
No.
Swallow hard. Good. All right. Next, I am going to perform the check for the strength from your neck. I'm going to press downwards if you can push against me with your resistance, no issues. All right. Next, I am going to perform the palpate the lymph nodes. Okay. Periocular, postocular, occipital, tonsillar, submandibular, submental, superficial, anterior, posterior, superficial is right here. For the tendon, I'm gonna ask you, tendon clavicle, I'm gonna ask you to look on that. Just turn your neck. Yes, your neck. I'm gonna try and feel the tendon, clavicular, and for the supraclavicular, I'm gonna try and feel any issues here. No issues with the supraclavicular. Sorry. All right, next, Catherine, we're going to do some neck exercises. I'm gonna have you move your head up and down, side by side, ear to neck, chin to neck, chin to neck, no issues. Okay, good. Next, we're going to go ahead and do the thoracic assessment. And I've already checked, I'm checking no skin issues, no deformities in the anterior and the posterior chest wall area, no issues at all in that side. I'm gonna go ahead and assess your breathing. If you can take, I don't see any accessory muscle use, you're breathing regularly with a good depth. Take a deep breath in and out, no issues. I'm going to palpate for any tenderness, for PMI. No issues. I'm going to palpate the back. Yeah, all the way back. Okay. For fremitors, Catherine, I'm gonna have you say the word 99 continuously.
99, 99, 99.
Okay. I'm going to percuss the posterior wall. Okay. Okay, come back. Next, I'm going to palpate the radial, brachial, carotid pulses, no issues. And I'm going to auscultate the carotid pulse with both the bell and the side. I'm going to auscultate the valves, mitral, aortic pulse, aortic, pulmonary. No issues. I am going to auscultate your lung sounds from the back. Take deep breaths in and out, in and out. Continuous in and out, in and out, in and out, in and out. Deep breaths in and out, in and out, in and out, in and out, in and out. Okay. I'm gonna go ahead and you can sit back up. Move on to the upper extremity assessment. I'm going to look at your capillary refill, any cyanosis, no issues with that. Okay. I'm going to go ahead and perform assessment on your upper extremities. Yeah, if you can stretch your legs, bring them back together. Move them to the side or the way together. Okay, and back again. Up to the roof, to the floor. Then, all right, I am going to try and keep your, I'm going to try and keep them close, bring them together, okay? How about try to move them apart? I'm going to check for the strength of your thumbs as well. I'm going to resist against my movement and resist again. I'm going to have you squeeze on my fingers, and I'm going to have you pronate, supinate, pronate again, supinate. Okay, thumbs. I'm going to try and press. No issues with that. All right, I'm going to go ahead and move, extend your elbows, move them up and down, up again. I'm going to move, apply pressure to bring them up and apply pressure, try to move them inwards. Okay, I'm going to go ahead and assess your shoulders, no issues. I'm going to go ahead and have you put your shoulders up, hands up and down, and across the front of you, up again to the side, the back of your neck, back of your head, and back. All right, good, no issues. All right, next, I'm going to go ahead and move to the abdominal assessment. Battery low. I'm just going to connect my thing here. Okay. We're going to move to abdominal assessment. I'm going to help you lie down. Oh, you need this. So abdominal assessment. You're gonna move down a little bit. So your head is well supported. Before we move to the abdominal assessment, I'm going to go back and do mitral valve assessment. It's better to do it in the lateral position. I'm gonna have you lie facing that side. I'm gonna listen with both. There is no doubt. All right, no issue with the mitral valve. Abdominal assessment. I'm going to go ahead and inspect the abdomen. Knees bent. Okay. Inspect the abdomen, no issues, no lesions, rounded, not distended, and nothing going on. So I'm going to go ahead and auscultate lung sounds, auscultate 4 quadrants. I'm going to go ahead and auscultate. Let me move the camera closer. Auscultate the 4 quadrants. Aortic, iliac, renal, and femoral arteries. Femoral arteries, aortic, iliac, renal, femoral arteries. While we're here, I'm going to palpate the inguinal lymph node. I'm going to palpate the aortic artery, checking for size. I'm now going to percuss the 4 quadrants and percuss the liver, the spleen, and the kidney. Okay. I'm going to perform a light palpation. The 4 quadrants and a deep palpation. Take some deep breaths. Deep breath. Perfect. No issues. Captain, I'm going to have you sit up. I'm going to check for CVA tenderness. I'm going to apply some pressure. Let me know if you're feeling any pain. Any pain?
No.
Okay.
No.
While we're here, I'm going to check the back, the sternal area for any deformities, for any issues. No issues with the spine, the sternal area. Catherine, I'm going to have you lie back. We're going to move on to the lower extremity assessment. I'm going to inspect the skin. No issues with the skin, no edema, warmth is good. I'm going to check the knees for any effusion, no edema, no pain. I'm going to palpate the femoral, popliteal, tibial, dorsalis pedalis, and posterior tibial. All right, while we're here, Catherine, we're going to perform some movements. I'm gonna have you bend your knee towards your abdomen, one at a time. Okay, and this one, nice. And I'm gonna have you abduct and adduct the knee and back on. Okay, abduct, rotate. You're gonna do the same for the lower extremity. If you can bend your knee and move out and inside. Same, bend, out, and in. Good. Captain, I'm gonna have you lie on your belly. And I'm gonna have you bend your knees, okay? And one at a time, I'm gonna have you lift as much as you can. I can help you with that. Off the floor, lift as much as you can towards the roof. Lift as much as you can towards the roof. Good. All right, Captain, you can come back to the position. I'm gonna help you sit up. Okay. You can have a seat. I'm gonna move the camera back to position. With my stethoscope. All right, Kathleen. Next, I'm going to check for your. I'm gonna have you extend your knees and flex. Okay, for your All right, sorry. Extend your knees, flex. And for your feet and your toes, like up from the floor and down, back. Good. Good. All right, next I am going to upper extremity. Next I am going to have, we are now going to move to the neuro. No, first we have to abduct. Sorry, with the knees. All right, I'm gonna have you abduct outwards. Abduct and adduct, sorry, and back in. Same, adduct and back in. Flex. Let's do the same with the toes. Flex. First of all, put them up and down. Okay, and back in. The same for that. Up, down, out, in. All right. Now we can move to the neuro assessment. Captain, I'm gonna check for your gait. If you can stand up and walk towards the wall and back again. Towards the wall and back. When you're walking back, walk on your toes and then heel to toes. Good. I'm gonna have you try and jump up and down. You can. Okay, I'm gonna have you bend as much as you can down and up, backwards as much as you can. Okay, try and reach on your side, the other side. Rotate. Side. You're going to perform the Romberg test with your eyes closed, Catherine. Gonna feet together, okay? I'm gonna count up to 30, 1 to 30, and I'm checking for any swaying and no issues with that. First of all, you're going to open your eyes, okay? And I'm gonna assess when your eyes are open, it's okay. Feet together. And then we're going to close the eyes. And I'm going to count 1 to 30 and no issues. So, Catherine, next, we're going to do the pronator drift with your hands, palms facing up. I'm going to count 1 to 30, close your eyes. 1 to 30, and I'm checking for any drifts and sways and no issues. And that's good. All right, next, you're going to check for lower extremity, your mass strength. Lower extremity strength. All right, I'm going to move this. Apply pressure on your thighs. If you can try and move them up. And apply pressure below. You should move them back. Okay. For your knees, I'm going to apply pressure. Try to extend them outwards, and try to bring them in. Okay. All right. For your toes, I'm going to apply pressure on them. Try and move them up and move them back down. I'm going to go ahead and do the foot tapping that we forgot to do. Just tap, foot tapping test. Also, I'm going to backpedal and have Catherine do the alternating finger test for the upper extremity. So with your finger, try and move them. Alternating finger and alternating. Sorry, just backpedaling on that. All right, okay. That is done. Next, we are going to check for the reflexes. Bicep reflex. I'm gonna hit my tongue, so. Okay. And tricep, brachial radialis, bicep, tricep, brachioradialis, knee reflex, knee, and knee, and I'm just looking for find any movements. And for the ankle reflex, I'm going to look for the Achilles tendon at the back, and that's what I'm going to hit. Achilles tendon for the back, and that's what I'm going to hit for the reflexes. Next, we're going to move on to sensory assessment. Catherine, if you close your eyes and tell me if you feel something cold or hot and where.
Hold on the right hand.
Okay. Your eyes closed, tell me if you feel one finger or two fingers touching you and where.
2 fingers on the left hand, 1 finger.
Hmm?
2 fingers
Mm-hmm.
on the left hand, 1 finger on the forehead, 2 fingers on the left hand.
Okay. Next, we're going to check for pain and dullness. Just let me know if you feel like something painful and where.
Painful on the left hand, painful on the right hand. Soft on the right hand.
Okay, like soft dull. Okay. We are going to do the 2-point discrimination. Catherine, tell me if you feel one thing touching you, pricking you, or 2 points, okay?
2, 1, 2, 1.
All right. We are going to do the stereogenesis test. Catherine, tell me what object you feel in your hands.
It is a coin.
A coin. And the Graph-Thayer test. Catherine, tell me what number I'm writing on your palm.
1.
Okay. Thank you very much. That marks the end of my assessment.